Ram teacher, shall we wait for a few more minutes?
Wait for some 2 or 3 minutes
Okay.
because it's so late now.
Ah.
We've gone live on YouTube. Huh?
Okay, sir.
And inclusion of LGBTQ plus populations organized by Pete Memorial Training College in association with Pete Educational Psychology Study Center and the Internal Quality Assurance Cell. As Craig Sloan, a psychotherapist and clinical social worker, puts it across, the pain associated with the social stigma of being LGBTQ, of living in a culture that is, for the most part, homophobic and heterosexist, is traumatic. This stigma can make life's typical slings and arrows all the more painful. Although tremendous progress has been made in LGBTQ plus rights in the past few decades, we still need to work towards social inclusion and make the global community a better and right place for them to live. The Indian context, though, a truly inclusive society remains a distant dream. Today, homosexuality and queer identities may be acceptable to more Indian youth than ever before, but within the boundaries of family, home, and school, acceptance of their sexuality and freedom to openly express their gender choices still remain a constant struggle for LGBTQ plus community. The solution starts from getting to know them better, and hence we have today an international web talk on the topic acceptance of inclusion of LGBTQ plus populations. The speakers of the day, Suzanne George Kalapurackal, will talk to us on the life tussles that LGBTQ plus youth find themselves involved in on a daily basis, the detrimental impact that these hardships have on their psyche, the role of teachers in a support movement that could bring about positive change, and above everything else, why it is so imperative that we lend them an ear and hand. Before we begin, I invite the Secretary of Religious Association and City Joy for the invocation.
Let godly light and encircling glow, let thou be on. The night is dark and triumphant hope, let thou be on. Keep thou my feet, God, do not ask to see the distant sea, one step enough for me.
Thank you, Nancy. Now I invite Dr. Ali Molivergis, Coordinator, Pete Educational Psychology Study Center, for the welcome address.
Thank you, Jibin. Good morning, everyone. The Pete family is very happy to welcome you all to the web talk on the acceptance and inclusion of LGBTQ plus communities. Our perception and attitude towards such communities may vary, but it is a fact that our society includes such people. In Kerala, we may not be so familiar with gay and lesbian life, but transgender is now being understood and considered as part of our society with their own rights. But the situation in other countries is quite different. Gay villages, LGBTQ rights organizations, LGBT employee groups, LGBT groups in schools and universities, and LGBT affirming religious groups are there. So, in this fast changing societal norms and structure, it is quite important that we discuss about the changes that are happening and gain an understanding about how to treat people with differences with dignity and acceptance. I hope this web talk will be an eye opener on these aspects. The Pete family is indeed very happy and proud to introduce the resource person for the web talk, Suzanne George Kalapurackal, Senior Medical Intern at Chong-Hua Medical Center, Philippines. Suzanne is a person of discipline and hard work, and that explains her success. She reads a lot, is a good singer, and a source of encouragement and support, especially to her mother, our respected principal, Dr. Mariama Matthew, and all other family members and her friends. She is our child as well. That is why we are proud of her. So, on behalf of the Pete family, I extend a wholehearted welcome to Suzanne George Kalapurackal. May God Almighty bless all your future endeavors.
Thank you so much, teacher.
Welcome, Suzanne. Let me also welcome all the participants who have joined us today from various parts of the country and abroad. Hope that this will be a fruitful event to all of you. A hearty welcome to all. Let me also welcome our principal, faculty members, administrative staff, our esteemed alumni members, B.Ed and M.Ed students, and all who are part and parcel of the institution. Once again, a hearty welcome to all. Have a great day ahead. Thank you.
Thank you, ma'am. I invite Divya S. to introduce our speaker for the day.
A warm good morning to all. Today is a special day for all of us. Our big Educational Psychology Center and the Internal Quality Assurance Cell are organizing an international web talk titled A.S.A.P. A.S.A.P means acceptance, support, and promote. The theme of this web talk is the acceptance and inclusion of LGBTQ plus communities. I would like to introduce our speaker, Ms. Suzanne George Kalapurackal. Ms. Susan George Kalapurackal maintained an excellent academic record in her school and college period. Ms. Susan did her undergraduate degree in BSc Biology and MD from Cagayan State University, Cagayan de Oro, Philippines. Now, she is working as a senior medical intern at Chong-Hua Medical Center, Cebu City, Philippines. She is also an active person in discussions about social issues, including the problems of LGBTQ community. Other than the academic excellence and performance, there is something special about our today's spokesperson. She's a daughter of our one and only principal, Mariama ma'am. It is one of the dearest moments for all of us. So, I heartily welcome Ms. Suzanne George Kalapurackal for the web talk. Susan ma'am, now the session is all yours.
Thank you so much for the very warm welcome. Good morning, everyone. It's indeed a great memory and great pleasure for me to be talking to all of you. Basically, because Pete Memorial has always been a part of my life. I've literally grown up in Pete. That's what I want to say, because I've always been in Pete when I was little, ever since I was little. So uh, it's a great moment for me. Thank you so much for inviting me to share my thoughts on the LGBTQ community and giving you my share of knowledge into the universe. First of all, I would like to say that LGBTQ community is very prominent these days, because many people, more and more people, are coming out as gay or lesbians or bisexuals. And what is it that's new in this current the PowerPoint? Please let me know if it's visible or not. Am I audible to everyone?
Yes, you're audible.
Yeah.
Thank you so much. Okay. Okay. One more thing. I'm gonna say this because I am as young as you guys. I'm only 24, so maybe I'm not very fluent with my topic, or I'm not very good at expressing sometimes. So please bear with me if there is any mistakes, and thank you. Okay, so the very first thing is about our heading. It's ASAP. So what is ASAP? So acceptance and inclusion of LGBTQ population is the main content of our talk today. It's not that LGBTQ population existed. It's not that they were like new or something. They have always existed in our society. But why is this a very important topic these days? Why? Because the society in a lot of countries, homosexuality is still a crime. It's considered as something uh, to be penalized, and a lot of people are suffering because of that. The society, especially the homes that they live in, or the schools that they study, or the institutions that they work in, they always face prejudice and ostracization from many of them. So how can we make it normal? Like, this is it's high time that we make it normal for them. And I'm going to share my thoughts and information about LGBTQ community, and I hope it'll help you in some way or the other. So according to Article 1 of the Universal Declaration of Human Rights, All human beings are born free and equal in dignity and rights. So the key point is all human beings. All human beings, in the sense, no matter who you are, whether you are a man or a woman or any other gender, maybe you were a transgender or a pangender or whatever, you are born free and equal in dignity and rights. You deserve to live a normal life. You deserve to enjoy all the rights that it's equal, like everyone is supposed to get it equally. So I know very most of you are very familiar with the abbreviation, but let me just make it clear again. So LGBTQ's L stands for lesbian, G stands for gay, B stands for bisexual, T stands for transgender, Q stands for queer or questioning. We'll get into each of them one by one later on, but just put this in mind. A quick fact check before we move on to the basic terminology. So, approximately 5 to 10% of the general population in the world is lesbian, gay, bisexual, or transgender. And these days, there are several more terminologies coming out. People identify themselves as a different gender every now and then. That can also be included. So, according to the American Psychiatry Association, back in 1973, they have declassified homosexuality as an illness and have removed it from the Diagnostic and Statistical Manual of Mental Disorders, or the DSM, which is basically the Bible of psychiatry. Germany and Sweden have the highest proportion of people identifying as other than male or female, according to a 2019 Ipsos poll finds. And globally, 1% of the adults currently describe themselves as transgender, non binary, non conforming, gender fluid, or in any other way, rather than as a female or a male. So there are too many terminologies coming in. What is gender binary, non conforming, gender fluid? These are all very new terminologies for a lot of us. Even for me, I wasn't really sure at first what it was. So we'll get into it. But before that, we need to look at the statistics as well. So if you look at India, 59% of LGBT people are being open about their sexual orientation or gender identity with everyone, that they support these many people who are open about their sexual orientation. 39% of people support people displaying affection in the public, PDA. 56% support openly lesbian, gay, and bisexual athletes in sports teams. And 55% support having more LGBT characters on television, films, and in advertising. So some of the terms that I'm going to say in basic terminology is very, very basic, because some of them we have learned ever since we were in elementary school, I'm guessing. But even before that, the reason why I even took on to this seminar was because at heart, I'm a supporter for LGBTQ community, and I respect the community. And this is something, the zest of the whole seminar is that sexuality is not a choice, and it's a part of a person's identity. It's not something that you can change. It's not something that uh, you wish that you could change or anyone else could change. So, to be kept in mind. So, this is very basic. This is very basic. We need to know what is the difference between sex and gender. So, sex is basically something that's assigned by a doctor at birth. And what determines sex? Sex is determined by your chromosomes, your hormones, and it's either you're being a male or a female, or in today's scenario, or even before that, and much before that, that we even didn't even knew existed, transgender communities or intersex communities, etc. So, but gender, what is gender? We always confuse sex and gender a lot of times. And gender is socially constructed roles, meaning to say that society is telling you, society is putting this for you to become a man or a woman. There are things that are affecting being a gender, like your behavior, the things that you do, that the society considers appropriate for boys and men and girls and women. So this will influence the way people act, interact, and feel about themselves. So there is this pressure or there is this impact of the society on you to be who you are as a gender. But even before that, like we used to think there were only two genders, either you're a boy or a girl. But now that there are more research studies going on and that there are much more information around us, like on the internet, on textbooks, etc., we can say that gender is pretty much like this. There are multiple colors. It's not just about boy and girl, it can be a lot of types of gender. Is my slide visible to you?
No, Suzanne. No.
No, ma'am.
Uh,
Please mute your mic. Others, please mute your mic.
ഇപ്പൊ കാണാവോ?
Yeah.
Yes, ma'am.
Okay. So the next terminology that we are going to discuss is gender expression. So gender expression is how a person publicly expresses or presents their gender. Suppose you are a woman and you dress like a man, that is your gender expression. So it can be anything like your behavior or your dressing or your makeup or your body language or the voice that you own. So this can be anything. It's not one thing at all. It's about different aspects of gender expression. Next one is gender role. Gender role is the behavioral, personality, and attitude traits that the society designates as masculine or feminine. We must have already heard a lot of times that boy is very feminine. He dresses up like a woman, or he has got those feminine features, etc., etc. So that is a gender role. That is something that the society puts on you. It's something that the society imposes on you. So that is gender role. Now, this is the main topic today: sexual orientation. We cannot like classify it into just two or three types. There are different sexual orientations that are being studied upon and written upon every now and then. Before that, we need to know what exactly is sexual orientation. So sexual orientation is an enduring emotional, romantic, or sexual attraction that one individual feels towards men, toward women, or toward both. So, sexual attraction, romantic attraction, and emotional attraction are the three main components of sexual orientation. So, sexual attraction is when you're sexually intimate with other people. Romantic attraction is when you're having a romantic intimacy with another person. Emotional attraction is when you desire to connect with others on a deep emotional level. It need not be including any sexual attraction or romantic attraction. You are emotionally attracted towards your friends or your colleagues or your parents, etc., etc. So there are three types of sexual orientation that was initially studied on. First one is heterosexuality. So heterosexuality is when an individual is attracted to the opposite sex. Homosexuality is when an individual is attracted to the same sex. Bisexual is an individual who is attracted to both the sexes. So I'm saying individual because I don't want to confine the gender. It's not that this person is a man or a woman. It can be a transgender, it can be a cisgender or a pangender person that can be attracted to the opposite sex or the same sex or both the sexes, etc., etc. Now, if you look at the statistics, of India, only 17% is combinedly would wish to describe that like describe your sexual orientation. So 3% of them are only attracted to the same sex, 4% mostly attracted to the same sex, 9% is equally attracted to both the sexes, 14% is mostly attracted to the opposite sex, 55% is only attracted to the opposite sex. Some of them don't know, and the rest of them, they prefer not to say. Now, this is something that came across to me as a huge piece of information because I was not really sure about asexuality. This is something that I have read, but not really I did not dig deep into this. But now that I had this opportunity, I had to go through asexuality. So, asexuality is someone who feels little to no sexual attraction at all. How is that even possible? That's probably one of the first questions that comes to our minds, right? Like even for me, I thought, why is there any way like we feel no attraction, no matter what kind of attraction, maybe a romantic attraction or a sexual attraction or any kind of attraction to any person? But that is a fact. It's a fact that there are people who feels little to no sexual attraction, and there is a spectrum of for asexual uh, people. So basically it's like there are people who can sometimes connect to other people but not in a society devised way. Like it need not be something that society is telling you to be attracted to. Can be some people can be not really attracted but more felt uh, as a sort of personal thing than being like attracted. Like attraction need not be the exact feeling that they are feeling. So they refer to themselves as aces. So asexuality, there is particularly no biology behind it because even when I studied on it, it's as common, and it's not common mostly, but it's more it's as normal as being straight or being heterosexual. So that is all asexuality is about. Now the next topic that we are gonna talk about is gender identity. Gender identity is one's internal understanding and experience of our own gender. So it is something that is in your head. That is something that you think about yourself. And it's every individual person's experience, and it's very unique and very personal. If you are externally a woman and you are not feeling as such in your head, you can be feeling like I don't belong to any, either being a man or a woman, or I feel like a man. It's all up to you. It's your totally personal experience. So, those people who do not identify themselves as either a woman or a man can be considered gender queer. Now, non binary is someone who does not identify exclusively as a man or a woman. So we later before we heard about gender queer, so non-binary people are referred to as gender queer people. They consider that their identity fall outside a traditional woman or a man spectrum. It's not something that you can fit into either of those genders. Then they are again described using the term gender queer. There are a couple of terms that we need to be sure about because I'll be keeping on repeating the same uh, topics. So, first one is cisgender. So, a cisgender is an individual whose identity matches the sex they were assigned at birth. An agender is someone who identifies as not belonging to any gender. Bigender is when a person who fluctuates traditionally a male and a female gender based behaviors and identity. Pangender refers to a vast and diverse multiplicity of genders in the same individual that can extend infinitely. So, pangender is again a very new term. Pangender is someone who can be attracted to any sexual orientations. Like you can any genders. You can be attracted to a male or a female, or an asexual person even, or a transgender, etc., etc. Genderqueer again has a gender identity or expression that is not the same as society's expectations for their assigned sex or assumed gender. And gender fluid has a gender identity and presentation that shifts between or shifts outside of society's expectations of gender. Why is it important to know this? So, may not be in India because we don't really face a lot of people who are gender fluid or gender queer or asexual, or many of them they do not come out because of the fear that they have for the society. But it's always good to know more information. And this they people sometimes tell you to please address them with certain pronouns like him, her, they, they, etc. So this is in order to portray their identities, and also to most importantly note, it's not safe to assume someone's gender by the way they walk or talk or dress or anything. Like, we cannot judge someone their gender identity or their sexuality based just on their outward appearance. And it's also okay not to know the correct pronouns. Sometimes it's, if you are close to that person, or if you are respectful enough to them, you can always ask them what pronouns that you should be addressing them. Sometimes they may not be open about it. They may not be happy with probably telling it out to you, but it's your part to know what the pronouns are. That's a sign of respect to the LGBTQ community. Now, intersex. Many a times, intersex is mixed with transgender, but they are totally different stuff. So, intersex is a variety of conditions in which a person is born with a reproductive or sexual anatomy that doesn't seem to fit the typical definitions of a male or a female. So, this is something that has been under study for many, many years. This term was coined even in 1917 by Richard Goldschmidt, who was a geneticist. And in 1960s, this was what, 60 years ago, uh, there were doctors who, when they discovered that the baby that's born is an intersex, they immediately do sex confirmation surgery without the baby's consent, but with the parents' consent, obviously, because they are the only ones that can give the consent. Uh, it's very unethical. But there are places in which intersex babies are abandoned. They can get killed, or they can be mutilated. So there are guidelines in countries where you can conduct surgeries for intersex babies at such a young age. But in my personal opinion, as a medical health professional, this is something that the baby gets to decide once they reach a certain age. uh, Most of the time, when the individual grows and when they realize that they were a different sex before when they were born, it puts them in a lot of mental health issues like depression and anxiety, and the fear of not being accepted in the society if someone else comes to know about it. So this term intersex was previously used to discussed in this term called disorders of sex development by some medical professionals and community members, but it's no longer considered because it has become a derogatory term for the individuals out there. Many people have spoken up, and bodily autonomy is a human right. That is the main point of intersex. No matter what you are born with, you nobody else has the right to change you, whoever you are. So that is the concept of intersex. Now, gender non-conforming. I guess if we all are active on social media, I feel like a lot of people have openly come out as gender non-conforming. Many people consider it's easier to come out on social media than to their colleagues or parents or their close ones, etc. Even though there are a lot of body shaming and a lot of other stuff going on. But gender conforming is people who do not follow other ideas or stereotypes and about how they look or act based on the female or male sex that they were assigned at birth. So it's something that's constructed culturally, and it's depending on the culture. Like some people, for them it's easy for them to be coming out as gender non-conforming, and it may be either perceived in a positive or a negative way. So the Q in the LGBTQ can either be queer. So we have already discussed about queer. Now we are discussing about questioning. So questioning are the group in the LGBTQ people who identify themselves as a part of the community while avoiding labels and still honoring that they are in the process of self-identification. So this is something that's gonna come in handy for teachers like all of you, because the age of self discovery is school age basically. I feel like because you will be questioning your sexuality, you are debating whether you fit into a particular sect of gender in this that's according to the society. You'll always be confused. I feel like I don't think it's properly addressed in India, but in the schools in US and UK and all, there are research studies being conducted on students who are questioning their identity and sexuality. So it's about the process of discovery and exploration of their sexual orientation, expression, gender identity, or a combination. So it's about discovering yourself, your identity, and it's very important, something that we were not taught at all in our school life or anything. But at least the next generation would be glad that their teachers know about this and are open about this. Gender diverse. So gender diverse is the extent to which a person's identity, role, or expression differs from the cultural norms prescribed for people of a particular sex. So this is the term that's becoming like more, this is one of those terms other than gender non-conforming that's becoming really popular these days to describe people because they do not fit into, or they do not follow a particular gender or a sex in the society. That's more that makes their individuality more affirming and potentially less stigmatizing than gender non-conformity. Now, transgender. So, transgenders are people, it's like an umbrella term. Like it does not include just one type of people. It can be people whose gender identity, expression, or behavior does not conform to that typically associated with the sex to which they were assigned at birth. So, your sex assigned at birth need not be your gender identity. That is a totally different thing. That's why in the beginning I explained all those terms so that you can get an idea of what the difference between all those terms are, so that you don't get confused. And I'm pretty sure a lot of people know about this, but I'm just saying this because we may always like stigmatize and keep people who are transgenders aside because they are something different. That is always in our perception. So they may identify themselves as straight, lesbian, gay, bisexual, asexual, etc. So transgenders are either a trans woman or a trans man. So a trans woman is a female who was born as a male. They've undergone gender conforming surgery to become a female. Trans man is a male who was born as a female. So I guess those terminologies are clear. Also, transsexual. Transgender is a colloquial term, but transsexual is a medical term that refers to individuals who have undergone some sort of medical or surgical treatment for gender affirmation or confirmation. So, transsexual individuals may identify as transgender, although many primarily identify as male or female gender to which they have transitioned. Here again, we have statistics. So this is the ratio of people who have identified as transgender, non-binary, gender fluid, non-conforming, according in a global country average, according to an Ipsos study that was conducted in 2021. So now that you look at it, 19% identify themselves as lesbian, gay, homosexual. 9% identify themselves as bisexual. 17% identify themselves as pansexual and omnisexual. 12% identify themselves as asexual. 7% others, they may be questioning, they may be trying to understand themselves. 19% identify themselves to be straight or heterosexual. 12% they still don't know. So let's leave them for that. Now, this is something, this is considered as a mental health disorder according to the diagnostic manual. Gender dysphoria. So this is not something that is confined to a certain gender. This is seen mostly, even though in transgenders, gender dysphoria is the distress, or it is the incongruence. It is the dissatisfaction that accompany with the incongruence between one's experienced or expressed gender and one's assigned gender. It's like you know that you are a woman, but inside you feel as a man. That distress that happens because of the uh, difference that you know is called gender dysphoria. So the gender dysphoria is experienced a lot in children, and they experience this as children, but then mostly when they become an adult, they don't really feel it anymore. So it is to be noted that not every transgender individual is distressed, but it can happen if the desired physical intervention, surgery, or hormone therapy is unavailable. Now, this gender dysphoria comes with a price, and it's accompanied mostly by depression, anxiety, attention deficit and hearing disorder like ADHD, etc. So that is the outcome, that is the symptoms, or that is the diagnostic criteria for diagnosing gender dysphoria. So gender dysphoria was previously called gender identity disorder, and many people these days consult for the treatment for psychotherapy and everything for gender dysphoria. And that's a huge step, because a lot of people, because of the lack of availability of help, never did that, and they had to suffer it throughout their lifetime. Even though some people no longer experience this when they become an adult, it's still a very serious issue. Now, how is gender dysphoria presented? So oh my God. Am I still audible, or is the noise too high?
Audible.
So this is seen from childhood, usually from 2 to 3 years old. Most children are not evaluated until 6 to 9 years old, at a point in which the gender dysphoria is chronic. They may be presenting symptoms, but the parents may not be knowing that they were presenting the symptoms. So it is presented as they prefer cross-dressing, insist that they are the other sex, wish they would wake up as the opposite sex, negative feelings towards their genitals, etc. Now, transgender and gender diverse children may exhibit similar preferences, may both desire to have another gender than the one they were assigned, and may draw themselves as another gender in self-portraits. So that is how the child presents gender dysphoria. Rates of gender diversity in children appear to decrease with age, and this change may be related to adolescents attempting to conform to peer and family expectations about cross-gender behavior, and therefore may not indicate a true change in gender identity. So this is the main thing, is you need to diagnose if this is actually gender dysphoria or not. It may also have to do with gender exploration, morphing into sexual identity exploration and consolidation, as in the case with those gender diverse children who develop into non-transgender, gay, bisexual, or queer adults. Now, how can we help children slash adolescents who are going through gender dysphoria. As long as they're open about gender dysphoria and you realize what gender dysphoria is, there are ways in which we can help gender dysphoric people. Now, first option is psychotherapy. Now, psychotherapy is still something that's looked down upon in our society because it's something that everyone worries about, that may affect them in the future. But the more earlier you get the help, the more easier it will be for the person to recover from the gender dysphoric state. So, if a person is assessed and clearly seeking physical gender reassignment, which means to say there are times when gender dysphoria can only be, it can be minimal, like it need not be something that can be progressive. So gender dysphoria sometimes can uh, make the person come out to choosing gender reassignment surgery, and has this person who seeks psychotherapy may just need help to figure themselves out. So maybe that's what we are trying to give. Psychotherapy is a great option. Hormonal treatment for those people who need to change their gender, and there are sex changing surgeries as well, which is the most common surgery involving the removal of the genitals and creation of artificial genitals so that the person can no longer go through gender dysphoria throughout their life. Now, some patients also perform non-genital. So it's not necessary that sex change surgery just involves changing of your genitals. It can be breast augmentation, facial feminization. Like there can be people who will be having rhinoplasty, which is basically the nasal septal removal or changing in the nasal septum and all, brow lifting, hairline changes, or vocal cord surgery. Some may not be happy with their voice. They may sound too feminine or too masculine or whatever the society is imposing on them, and they wish to change that. So that can all lead to gender dysphoria. Minor things that we make fun of others that can somehow impact them in a way that we may not be even knowing about. Now, transitioning. Transitioning is basically any legal, social, or medical step an individual take to affirm their gender identity or gender expression. It can be either through a surgery or through hormonal treatment in moderate doses. It all depends. It depends. It's up to that person on how they wish to transition. So it can either be using a new set of pronouns like he, she, they, them, etc. Wearing a different type of clothing, going through the process of changing one's name on a legal document, changing one's gender marker on driver's license, etc. Getting surgery to affirm one's gender. It's all the perception of the person who wish to transition. It's all their decision. Now, this is something that we see every now and then on social media, especially on Twitter, Instagram, etc., etc. So, what is exactly queer phobia? Queer phobia is basically the hatred or fear that individuals have for queers or the LGBTQ community, especially that I have seen is homosexuals. If somebody is coming out, they prefer to come out on any app like say Tinder or Instagram or any social media platform. They are always faced with a backlash. They're close, even sometimes from their own family or their closest friends whom they have already opened up. We may not know where the backlash will be coming from. But there are two types of queer phobia. There are overt and covert queer phobia. Queer phobia is people being queer phobic proudly. Like they are not ashamed of hurting someone else. Like they don't consider the other person's emotions physically harming queer people, openly admitting that they hate the queer people, and mentally abusing queer people through their comments and backlashes, etc., etc. So covert people are people trying to disguise their queer people. Like they think that that's because again for the lack of ignorance, because of the lack of ignorance and lack of awareness that persists in our society. Covert people think homosexuality and transgender is just a joke, or like they will be starting a sentence like I am not queer phobic, but I have so and so issues with this LGBTQ community, and backhanded compliments like making fun of a queer person indirectly. So that is the covert type of queer phobia. Now, according to the 2018 October statistics by the American Pediatric Association, the suicidal behavior that is seen in the transgender and questioning and even heterosexuals. We know that suicide is one of the major causes of death among the population, like one of the major causes. Even in America, it's the second most leading cause of death among people, in adolescents, in children, etc. So, even for heterosexuals, I feel like there is a certain point in life where we are faced with a lot of hardships and we have to choose between living another day or ending it. Like there were times when we all must have felt like that. But then consider people like LGBTQ community who are not even accepted by the society for who they are, for their sexuality. They are always questioned and made fun of. So it will become more harder for them to live in a society like that. So the reason why, if you look at the statistics, the rate of transgender female to male, neither male or female, questioning male to female transgenders, they are all, the rates are pretty high compared to the heterosexuals, and that, why is that so? Why is it still an issue? It's 2018. This statistics is from 2018. It was literally 3 years ago. Why is it still a problem in this 21st century? Why is this still a problem? So their sexuality, they being a transgender, has prevented them from obtaining an education or a job or a housing because of who they are, and they end up living in slums or streets, and they have to do sex work and begging, and this pitiful condition have led their emotional breakdown, and this discrimination, violence, stigma that transgender people carry in the society, where they are verbally harassed, physically and sexually abused, blackmailed, rejected. There is hatred, etc., etc. That can lead to suicidal tendencies. And there are many, many cases which have led to several deaths over the past years as well. Other than suicide, addiction is one of the core problems that has been assessed in the transgender community, mainly gender dysphoric individuals. So we have already discussed that gender dysphoria is something that's coming because of your lack of uh, acceptance of yourself, because then you know that you are not someone who you are inside, and you're outside and you're inside, there completely your gender identity is different. So when you don't have the resources, or when you don't have the uh, availability of help that you are supposed to receive, there are times when you feel that you want to get some sort of happiness, and that's what they tell. That's not my sentence. So individuals, they are they turn towards substance abuse and addictions, etc., etc., through drugs, alcohol. There are people who have attempted suicide because of the abuse and the addiction, and people who smoke a lot. There are different addictions and substance abuse that's seen in the transgender community. Now, recently, I think a lot of us have quite looked into this, the gender reassignment treatment. So gender reassignment is when seen mostly in transgender people, there is the physical treatment like sex changing treatment or hormonal therapy that they undergo in order to adapt to the bodies of their experienced gender or gender identity, which means to say that you are living in a body that you feel like does not belong to you. This is not something that you are. So you take treatments by hormones or surgery to change into something that you want to be and to feel accepted by yourself and the society. But there are instances where people, because of the ostracization and the prejudice that they face, they cannot have the means to have a gender reassignment surgery, and that is so that is a big issue in the society. So because of which there are transsexual people who do self castration, and because of the lack of resources, financially, they try to do it themselves, and when they cannot get the help that they need, they often fall into the pit of depression or anxiety, self-harming, etc., and which obviously, to an extent, if it progresses, can even lead to gender dysphoria. Now, this is the most controversial and very discussed topic of Ananya Kumari Alex, not uh, who was not treated properly for her um, sex changing surgery, and the doctor messed up the whole surgery, and then she was in physical pain, and she couldn't live a normal life like she wished to, and then she committed suicide. So this is one of the after effects of, not everyone, if you are good at doing the gender reassignment surgery, it's great, but the fact that she was abused in a way made it even more harder to lead a normal life. She could not even sit, she could not even stand. The basic things that you do in a daily life, she couldn't even do that because the doctor messed up the surgery. And this is something that should be discussed more and should be made normalized to a great extent. Now, coming out. Coming out is a very English term, I should say, because I myself have not witnessed any coming outs. I have seen it on social media platforms, and that's it. Because coming out is a very serious topic, because the people who wish to come out do not know half of the time to whom they should come out and when they should come out, because it's the way they are seen in the society makes it harder for them to come out. So what is coming out? Coming out is used to describe LGBTQ plus people's self-disclosure of their sexual orientation or their gender identity. uh, it's like saying, ma, I'm gay, or ma, I'm a lesbian. So that's how you come out. And it's not just one person, it can be to anyone whom you trust that you can come out. That is the whole process of coming out. Now, coming out is perceived differently in different societies. Obviously, a lot of times, due to the lack of ignorance, due to the lack of awareness and ignorance, many people think that being homosexual is a crime and it's not normal, and because of which lot of people send their children. So most of the people, especially this generation, comes out during their teen years, when they realize that they are not straight, or they are not whom the other people thought they were. When they come out, even without their consent or their knowledge, parents are the ones who push them for conversion therapy. So conversion therapy is something that people think is possible. Like, it's like asking you to be whom you are not. It's like an attempt to change someone's sexual orientation, gender identity, or expression, or any of these. This can happen either in a medical setting, or it can be in a religious institution, in the presence of spiritual advisors, or in a family meeting, or a peer support group, or anywhere. Now, what does conversion therapy do to people? So conversion therapy, they stigmatize the LGBTQ people, and that can increase minority stress, or the stress that comes from invalidation, non acceptance, and enacted discrimination. This can in turn lead to risk of depression, substance abuse, and suicide, among other problems, as documented by the Institute of Medicine in California. Now, an estimated 16,000 youth undergo a conversion therapy by a mental health professional before the age of 18, compared with an estimate of 57,000 that will undergo it from a spiritual or religious advisor. How shocking are the reports? Because this is something that I feel like even before conversion therapy, when a person who who is who he is or she is acts in a society, people will tell them to tone it down, or dance less, or be less feminine, or be less masculine, be less tomboyish, etc. And then that will make them feel something is wrong with them. And when the even when the parents realize that the your kid is a homosexual, or any person coming under the LGBTQ spectrum, they are often forced to do the conversion therapy. Now, this is not something to be. This is conversion therapy is highly illegal. This is not supported by a lot of the medical health professionals in a lot of countries. Now, according to the UN Human Rights Report from May 2020, if you look at the statistics, the majority, 43% conversion therapy happens in Western Europe and others. 22% happens in global or countries that are not specified. 1% happening in Africa, 10% in the Asia Pacific, and 10% in the Eastern Europe. So these are the after effects that we have seen over the past few years that happened in Kerala. I have taken all cases from Kerala. It was so hard for me to believe it in the beginning. The very first case that I've seen was of a man named Alex. He was tied up and sedated in a conversion therapy center somewhere in Kochi, where the institution is not mentioned. They are done doing it in the backdrop of, in the name of curing your homosexuality. That is the promise that the institution have given to Alex's parents. So what they do is that the cruelty that is happening in the institution cannot be justified at any point. The boy Alex, he ran away from the institution, and he tracked down the people who were with him in the institution. Some of them have killed themselves, some of them have killed their parents for putting him in that state, because the trauma that the people have gone through when they were undergoing the conversion therapy that was done on them. The conversion therapy techniques that the people use is chemical castration of your genitals, or shock treatments. It's the amount of ignorance that the people have for this is unmeasurable. I don't even know what to say, because this is something that is not, it cannot be changed. You cannot change someone's sexuality, you cannot change someone's sexual orientation. It's like asking you to be someone else. Imagine how traumatizing it will be for LGBTQ personnel. The other one is about Anjana Harish. She was found dead in Goa because she before she went to Goa, she was put in a conversion therapy center, and she was severely traumatized, and she was given sedatives and hormonal changing medications in order to change her sexuality. And the trauma and the depression that she went through cannot be fathomed, and that made her give up on her own life. And the Kerala student suicide that happened again in Trivandrum, I believe, that happened, in which the victim, she said that she was sedated without her consent and was traumatized, and she was given a lot of medications on which made her mentally and physically down. So imagine the pain and the mental exhaustion these people have to go through for something that is not their fault or anybody's fault, and just for who they are. So that is the case scenario that's happening around us now. This is something, the conversion therapy and all, it can happen at any age. But if you're looking at a much more school level or educational level, there are people who verbally and physically bully and abuse uh, the students who come out at that age. So it's like, look at the statistics. The LGBT teens, they are bullied 2 to 3 times as much as straight teens. More than 1/3 of the LGBT kids have attempted suicide. LGBT kids are 4 times likely to attempt suicide than straight teens. LGBTQ youth highly rejected by their families are 8 times more likely to attempt suicide than whose families accept them. So from all these, all the conversion therapy and the bullying and everything, the only thing that we can do from the lowest level is supporting them. Now, for many children, the gender identification, it begins at around 2 years old. Individual trajectory of cross-gender identification is variable, meaning to say that some people identify it quickly, some people may take their whole life to identify their gender. It's all dependent upon from one person to another. But the worst part is for those people who are being bullied, or people who come under the spectrum, they often face behavioral problems like attention deficit and hyperactivity disorder, oppositional defiance, etc. And there are people with significant rates of autism spectrum disorders as well, that is seen more in gender diverse and transgender children. Now, okay, this is the UN statistics on a global level of the portion of LGBTQ youth who reported a past suicide attempt. Now, if you look at it, there is 37% of transgender American Indian or Alaskan natives who conducted suicide, and 31% of either of these nationalities have attempted suicide. This is the Trevor Project global survey on the portion of LGBTQ youth who reported a past year suicide attempts. Again, if you look at it, it's American Indian, who is 32%, 19% of the Hispanic or Latin population, or either of them or any of them, 21% and more. This is the Indian 2019 June statistics that has been obtained from the Times of India newspaper clipping. The harassment for being homosexual or gay starts in primary school, and 60% face bullying in middle or high school, 43% sexually harassed in primary school, 18% report instances to the school authorities, 70% of the bullied suffer from anxiety and depression, lose focus in studies, and 33% drop out because of bullying. Imagine being not able to get basic education because you are someone who does not fit into the framework of the society. This is terrible. Now, this is a case that happened. This is a case that happened somewhere in North India. Now, uh, the girl who, there was this incident in the school where the children were asked to write an essay about your crush, and this one girl, she wrote about having a crush on a girl who is in the same class. Now, some of her classmates took snapshots of the essay and posted it on social media sites, and the problem became so grave when the teachers came to know about it, and even more grave when the principal asked both the girls to go kill themselves. And the girl who the other girl who was the crush of the girl who wrote it went and killed herself. That is because of the mishandling that has happened in the school, and many people were calling her a prostitute. And incidentally, like there were phases of depression that the girl before killing herself had to go through, and the social media did not take it well. Nobody took it well. We lost a life again for something that is completely normal and should be normalized at least at this point of time. Now, this happened in Tamil Nadu. So, in a survey of almost 400 LGBTQ youth in Tamil Nadu, so this was a survey that was conducted by UNESCO and Sahodaran, which is a Tamil Nadu NGO that's supporting LGBTQ community. Now, this is about a girl Shemba. Shemba is 15 years old, and she was bullied ever since she was 6. And she dropped out of school because of the bullying that her classmates imposed on her. And she wanted to become a lawyer so that she can fight for the community, but she no longer can because she could not complete her education. She used to skip classes because of the bullying that she faced in school. And currently she is a sex worker. She's begging on the street. And another student called Pragaya, she is 15 years old, and she's a transgender student, and she left the school 3 months before her final exam. Now she's doing odd jobs and begging for a living. So even in the school settings, there are rigid definitions of masculinity and femininity that's reinforced on everyone, and they are forced to follow a certain pattern of living, and they do not care about if there is a LGBTQ student in the class, and everyone picks it up and the children picks it up, and that's how the bullying begins. Now, this is a case in Vietnam. Uh, in Vietnamese schools, it's not just in Vietnam, but I'm just saying because this was a very prominent study that was conducted by Human Rights Watch. Now, in Vietnamese schools, verbal harassment takes place a lot. They are called names that cannot be found in the dictionary because that's how abusive they are. There are students from different types of schools. Can it be rural or public or private? And the teachers also use derogatory words to refer to the LGBTQ people. And sometimes they are targeted for with threats of violence. And most of the children, when they realize that they are being bullied and they are forced to skip school, many a times they cannot be open to their school authorities because they feel like the teachers won't understand, and it will be hard for them to convey the information. They feel like the teachers or the institution heads, administrators, they will not believe in them. So why is it hard for them to convey what they are going through, which is something so grave and something that can affect them physically and mentally. And this is because the people surrounding them, be it their parents or their teachers, they consider anything other than heterosexuality to be unnatural. And if anything other than heterosexual, they threaten their children with violence, with expulsion, with a medical treatment to come out of being gay or lesbian, as if something like that is possible. The belief that same sex attraction is diagnosable, treatable, and curable mental health condition is very persuasive in Vietnam. And uh, many health professionals, they are trying their level best to convey the idea that same sex attraction is a natural phenomena, and and it should not be considered as a social evil, or sexuality is not someone's choice, and it's something that happens to you when ever since you're born, or even before that. And it's very important to include these kind of studies to make it normal in the society. Now, what are the outcomes of being judged and ostracized by the society? According to an interview and research conducted by the Human Rights Watch in an unnamed high school in the US, there are times when you mention about when a group of friends they chat, and if someone mentions LGBTQ people, one or the other people would stop that person and say, "Don't talk about it. It's disgusting." That's why people never come out. That's the reason why people come out, because the prejudice that LGBTQ community has, that they face, is so immense that people who openly hate on the LGBTQ people, queer phobic people, they make it hard for people who wish to come out to never come out of their closet. And when a school counselor in the very same school said that, "I've had teachers tell me discrimination happens for a reason. Kids who are strange are going to get treated strangely." And the studies around the world consistently show that LGBTQ youth are at an elevated risk of adverse mental health outcomes, as I have mentioned earlier about depression, anxiety, substance abuse, and suicidality. Now, the research suggests that family support and a sense of positive future are resilience factors that protect against negative health and psychosocial outcomes. Gender diverse boys typically experience more negative reactions from their parents and experience more victimization at school than gender diverse girls. This is due to the great latitude given to girls expressing masculine behaviors in a society that overvalues male behaviors and undervalues female behaviors. Now, gender identity by key generations. So, if you look at the statistics again, uh, Gen Z, 4% of Gen Z, they wish to currently describe themselves as either transgender or non-binary, non-conforming, etc. Millennials, 1997 and above, they are only 2%. They currently wish to describe themselves. Maybe they are in the questioning phase. We do not know. So the statistics, this is again a statistics that's been provided by Ipsos in 2021. Now, this is what comes for teachers. Like, this is the handy kit for teachers and schools that can make the school a welcoming place for LGBTQ community. Safe schools for everyone. So what teachers and schools can do in order to support the LGBTQ students. Now, so this is a this is an approach that was released by UNICEF. It's the International Technical Guidance on Sexuality Education. This is in order to promote normalcy in the school settings for sexual education. So, this is a curriculum based process of teaching and learning about the cognitive, emotional, physical, and social aspects of sexuality. This is basically to make sex education, about sexuality and all, much more normal in a school curriculum rather than considering it as a taboo topic. How to be respectful to each other and to make good relationship with the LGBTQ spectrum, etc., etc., and also to protect their rights and to show that they deserve equal opportunities just like everyone else. So this is again a study conducted by Sukhind Kaur. She's a third year student at St. Xavier's College in Mumbai, and she conducted a study in which she realized the core problems of making homosexuality or the LGBTQ Q population more accepted into the society. So what all can we do? These are things we must know to educate the youth, to educate the authorities, educate whoever we can reach out, because homophobia, as I've said, is often a product of ignorance. Create formalized support and resource groups for LGBTQ plus Indians. Sex education, social awareness, workshops, and redefine curricula. Healthy media representation, and make sure this generation and the next understand queerness and how normal it is. So she is trying to prove that heteronormativity, which is the belief that heterosexuality is the normal orientation or the only norm, and that sexual and marital relations are only fitting between people of the opposite sex, is normal as being a homosexual person. Like both of them are equally normal. There is nothing abnormal about being homosexual. And this is something that should be taught, it should be educated to whomsoever we can do that to make the whole situation normal. This is an attempt by UNESCO in 2007 where they tried to include the LGBTQ topics in in the curriculum in Indian textbooks, and 13 Indian states called for an immediate ban because they said they were explicit content designed to impart comprehensive sexuality education against which they said were against the Indian culture and morality. So even we all know when we were in biology class when until we were in 10th, whenever there is a sexual reproduction, there is a reproductive system class that was taken. It was always uh, it was always never explained well, and it was considered as a taboo topic for many people, because this is something that we do not openly discuss in the classroom or the society. But on the other hand, this is supposed to happen, this is a very normal thing, and so is discussing about the LGBTQ youth. So the explicit content was the reason that the Indian states, 13 Indian states, showed to ban this particular topic from the textbooks. So this is Harish Iyer. He is a very prominent LGBTQ activist. Uh, he says that schools are, after all, represented by individuals who belong to the society at large. Basically, the students of today are the future of tomorrow. If they are not educated properly, it's very hard for their generation and the coming generation to realize that homosexuality or the LGBTQ spectrum is extremely normal, and they should be open about their sexuality and openly discuss and talk about sexuality and not make it a taboo topic anymore, at least in the schools and colleges. So this is the next generation. So school level. because I feel like sometimes if you are anyone under a LGBTQ spectrum, there are times when they cannot open up to their parents. Maybe someone like a very close teacher to you is the one that they wish to open up to, or they wish to come out as gay or lesbian, etc. So, according to UNESCO, support from teachers can have a particularly positive impact on LGBT and intersex students, improving their self esteem and contributing to less abstinence, greater feelings of safety and belonging, and better academic achievement. So this is something that you guys can be proud of, because you can help your students if you notice that they are struggling with something, just like any other issue, their sexuality can also be troubling them, and you can help firsthand in many situations. So as a teacher, what you can do to support LGBTQ students? Now, the first thing that we can do is to post a safe sign. So safe sign or safe zone sign is very important in a way that makes the children feel like, or they will let the this is how you can let your students know that all LGBTQ and all sexes and genders are equally well friendly, and we are equally LGBTQ friendly and willing to challenge anti-LGBTQ language or harassment. To openly we can openly discuss about the LGBTQ issues in the context of classwork or just in conversation, which means to say, like, we are not gonna put you aside because you are something different in your head or to the society. We are gonna hug you all together, and we are gonna make it easy for you guys, and we will make sure that we don't uh, make you feel left out. Now, also, the second thing that we can do is avoid assumptions. You, as teachers, we may not know. Like many a times, we may not know if there is an LGBTQ spectrum child in your classroom. So try not to assume that you know everyone's sexuality based on how they look or behave. Ask, never avoid asking questions like, "Do you have a boyfriend?" to girls, or "Do you have a girlfriend?" to boys. And these situations can make them feel excluded and uncomfortable. Now, the third way in which teachers can help is by offering to start an LGBTQ organization at your school. This is in order to reduce discrimination among the LGBTQ students, promoting their well being, and fostering safe and affirming school environments. They can create awareness in school and help to counteract discrimination, ensures that school policies and curriculum are inclusive. This is very, very important to stand up against homophobia, which means to say that you need to make sure that everyone understands in your class or in the school that using certain language that can hurt the population, uh, physical harassment, verbal harassment, any kind of harassment against the LGBTQ community in the schools will not be accepted. They will be taken into consideration for violence act and punishments, etc. So you can intervene people who are being bullied, and you can stand up against homophobia in the school. Now, integrate LGBTQ topics into the curriculum. This is very, very important. It may be hard, but there are changes that are happening slowly. This is in order to include LGBTQ topics um, in the educational materials, that can either be about HIV, um, or doubts that the children have about the population, etc., like diverse sexuality within the learning areas, always including the same sex attraction into discussion about sex and relationship and sexuality education. I mean, I know for a fact, since I have studied in India, sex education is pretty much non-existent. It's still a very taboo topic. Maybe it must have changed in the present generation, but there is still a lot to change. And when we talk about sex education, it's always a great idea to incorporate the LGBTQ topics into it as well. just like English or history or whichever subject is being taken compulsorily in school. Now, this is very important. This is something the current generation faces a lot because we are all on social media. That is cyberbullying. This is as serious and as grave as a verbal and physical harassment in person. And this is anything, according to the Cyberbullying Research Center, this cyberbullying is a willful and repeated harm inflicted through the use of computers, cell phones, and other electronic devices. So, as a school authority, or you can even, as teachers, can request the school authority by a joint agenda to start LGBTQ organizations and receive training for the teachers and students and counselors and the administration to take cyberbullying seriously and prevent it as much as possible, because we may not know how many lives must have been lost in the process of cyberbullying, and let's not make that happen again. Now, this is a huge change that has occurred during the past few years in the Vietnamese schools about teachers taking uh, initiatives to include LGBTQ content in their textbooks, and the reason why it is so necessary is because many a times there are people who cannot get relevant information that we normally get from textbooks. So what they do is they go and search upon the internet, and these days there are very relevant, good informations, but still it can be confusing for children. So it is better to provide from the school level itself so that we can make them more aware and confirmed about the LGBTQ population. Above all, we need to provide support. This is a very small term, but it means a lot to the LGBTQ population, because many a times, because of the persisting um, stigma that is on the LGBTQ population, it is hard for them to come out. And even if they come out, it's very hard. The phases that they have to go through in order to come out is becoming even more uh, threatening to the LGBTQ population. So if they come out, make sure that do not judge them, and always provide them support by understanding them, trying to understand what they are going through and how hard it is for them to come out. Every time someone comes out, it's not easy, and it's not equally well received in a community. So the best thing that you can do is to provide support for students. If it's many a times there are students who come out in schools, like the previous case that we have seen, let's just not lose another life because of their sexuality or their gender identity. Now, we have almost come to the end of our seminar. Now, this is something that has made my whole research on this seminar much more fruitful, because it was a great opportunity for me to understand about the Trevor Project. So, the Trevor Project is inspired from 1994 Oscar winning short film Trevor. So, Trevor is about a 13-year-old boy who identifies himself as gay and is having a um, hard time understanding that it's not normal. Okay, when he looks at himself, he does not find anything wrong with him. But everyone around him says that he's dancing a lot and he's walking weirdly, and there are people making fun of him for having a crush on another boy in the school, Pinky Faraday, and it's all putting him in a state to an extent in which he attempts suicide. So he is someone who loves Diane Ross. Diane Ross is a very famous singer. And for everyone around him, if they think that it's really weird, he planned to dress up as Diane Ross for the Halloween party, but then he drops it because he thinks everyone else thinks that he is weird. And he tries to end his life by eating a whole lot of aspirin, but finally survives, which is a good point. There in the hospital, he meets a nurse called Jack who gives him Diane Ross tickets to go out with him. So he decides to come out and decides to live another day as a purely homosexual individual and not be ashamed of it. Now, this is the story behind the Trevor Project. So, Trevor Project is the first American nonprofit organization founded in 1998, focused on suicide prevention, efforts among lesbian, gay, bisexual, transgender, and questioning young people. Now, this is the only 24/7 crisis intervention and suicide prevention program in the world. And this was such a great initiative. How this came into being is a very cool story, because now that you look on the screen, you can understand that the Trevor film was aired on HBO. And when the creators realized that there is no suicide prevention helpline available for LGBTQ population, they decided to give birth to the Trevor Project after a few years of effort. And they help the LGBTQ population through the Trevor Project Lifeline, Trevor Space, Trevor Chat, etc., etc. This is a huge affirmative initiative from the government of the US to help LGBTQ population and make them feel included in the society, and to make sure that they are not alone and they can always ask for help. Now, this is probably one of the oldest organization, the first and the largest organization, which is PFLAG. Now, PFLAG was established by Jane Manford in 1973 for the LGBTQ people, their parents, and their families and allies, etc. And it's committed to creating a world where diversity is celebrated and all people are respected, valued, and affirmed. Now, they work mainly among the schools for cultivating respect. This was one of their agendas. Safe schools for all. This is an umbrella program that supports the efforts, and they work with other national partners to raise visibility of the issues facing LGBTQ youth in learning environment is by cultivating respect. Safe schools for all program with this supporting publication. So they are trying to help through schools to make sure that the LGBTQ youth are not left out and they must be included in everyday life. Now, we are coming to Indian organizations. We are not left alone again. We are also growing. Now, the one of the biggest discovery was finding breaking barriers. So, breaking barriers is a LGBTQ student organization. So these organizations are called GSA, which means Gay Straight Alliance, meaning to say the heterosexual individuals helping homosexual people. And they make the schools and other institutions and workplaces welcoming and accepting for the LGBTQ people, regardless of their sexual orientation or gender identity, etc. So this is an initiative by the Tagore International School from New Delhi and was established in 2013. And the peer educators are trained by CREA, which is a reputed international gender rights organization with the NAS Foundation and NGO based in New Delhi. Now, what is their aim? They aim to discuss LGBTQ issues from the standpoint of human rights advocacy, bringing healthy sex education to other young people just like themselves in terms they too can support. Now, this is from the north side of India, Queer Ghar. Queer Ghar is a non-profitable organization that's based in Raipur. They organize sex, gender, and queer awareness workshops in schools, colleges, and corporate offices. And very recently, they conducted a Rainbow Over Vaga Pride event in which they did a joint initiative of the India-Pakistan Pride Collective, an organization of India-Pakistani peace builders for the LGBTQ equality. And this was the platform that was used for the amalgamation of the India-Pak peace efforts and the LGBTQ members who are facing multiple issues in both countries. What a great initiative. So this is from Kerala. We have two organizations from Kerala. One is Queerla. So Queerla, they started as a secret Facebook page. Now it's an organization for Malayali LGBT people, their family, friends, and allies who want to engage in demystifying stereotypes of queer people, learn and create safe spaces for LGBTQ people in Kerala. Now, their aim is to support individuals coming out and being comfortable about themselves, to disseminate national and international LGBTQ news in English, Malayalam, etc. Queer Rhythm. Queer Rhythm is an organization. This is a registered community-based organization working out in Trivandrum. In order to build a strong support group, they have taken the motto "Love Makes a Family" and organized the third edition of Pride Walk with a focus on positively highlighting the range of talents within the local queer community. Now, they have also worked towards the integration of eco-friendly activities in all their events. So most of these organizations are within our reach only. This is not only for the LGBTQ people, it's also for the allies or the people who support them as well, their families. We can all help them in different ways through an organization or just by being respectful to the LGBTQ community. Now, this is Yawol. It's Imphal based. It's from Manipur. Yawol in Manipuri means revolution, which is from obviously from the northeast side of India. And they work with adolescents and queer community to build inclusivity through advocacy, capacity, and building research. So this is the living manifestation of their meaning revolution. They put together the India's first all transgender football team. Their drop-in center, which they have a building for the organization that provides mental health care service through queer-friendly counselors and mental health professionals. Next is Queerabad. Queerabad is an Ahmedabad-based NGO that works towards the space of strength and peace for the queer community in a conservative city. And they have organized mental health workshops, poetry readings, etc. And they are also focusing on the help that they're receiving from the queer allies on board while also distributing pamphlets in Gujarati and Hindi. Now, since I study in the Philippines and have been observing quite a lot of people whom I was very fortunate enough to be taught by and have worked with, I'm going to mention a couple of organizations in the Philippines. And I can very proudly say that Philippines is the 10th most gay-friendly nation. And from my point of view, I have found that uh, because of the economic status of the country itself, I feel gay people are very, very hardworking and they shine in a way that we all envy them for because they are really, really cool people. And I've had the great opportunity to study and being taught by some of my professors as well. So the very first organization that I'm going to mention is UP Babaylan. UP stands for the University of Philippines. It was established in 1992. This is the very first LGBTQ student organization in the country. They aim to foster a safe community and provide support to the LGBTQ students across several campuses. Through their conference and workshops, they facilitate conversations on the experience and advertises the LGBTQ community. Now, the next one is Rainbow Rights. Rainbow Rights is a Metro Manila based nonprofit organization that was established in 2005. They put the focus on the law and policies catered to the rights of the LGBTQ community. They aim to create an environment that upholds human rights and equal access to opportunities to individuals of diverse gender identities. They do this legislative and policy work, capacity building, research, and publication. So it's always a great piece of information to know that the LGBTQ community are being supported not just for their achievements, but also for their work that they put in the development of the country. Now, From what all I have said, I would like to amalgamate everything that I have said with our topic, that is ASAP. So the A of ASAP stands for accept. Basically, all we need to do is understanding the LGBTQ community and accepting them for who they are. S for support, supporting their achievements, their hard work, and also supporting them coming out, etc. Act, in order to act against homophobia and include them in daily life situations that uh, stigmatizes normally in different parts of the world. P stands for promoting the goodwill, the good intentions, promoting the good insight that LGBTQ population carry, and not putting them aside and treating them as different. Now, so we all know that the Pride Month is the month of June. So this is a transgender man, Catherine Rednya. She is from the Iloilo city. She is the founder of Being LGBTQ Here organization in Iloilo city, which is quite close to my place. And according to her, true pride is determined by how she chooses to lead her life on a daily basis, openly, compassionately, and fully expressed. So that is all that they wish to do. They wish to live like anyone else and not be pointed out at or differentiated from the rest of the community. Now, this is something that is obviously meant to be discussed because we are all in the midst of a COVID-19 pandemic. And it's in a very healthy normal society itself, it's very hard for LGBTQ population to receive jobs and work, etc., etc. They are often being pushed out of the spectrum and denied of all the basic rights. Many people think that homophobia is something that's been imported from foreign countries and it's not belonging to their traditional values, etc., which makes it even harder during the COVID-19 pandemic. Because look at all of us, we are all in front of a screen all the time. We are learning, we are doing things that we are all like closed up into a box in front of us, and that is quite hard for just ourselves. So imagine LGBTQ community, they are already denied of their basic rights, and it's even harder for them to survive in this situation. So let's not put them aside, and all of the things that we enjoy is still a privilege for them, and we need to see it through the eyes of an LGBTQ person, even if we cannot be stepping into their shoes and trying to understand it. It's still very important to respect them. It is still very, very important to accept them. It is very important to support them and use correct pronouns and never degrade their individuality just because of who they are, and they are no different from any of us. Now, I would like to thank everyone by and finish this seminar by quoting my one of my favorite musicians who happened to speak at the UN organization events. And according to him, that I truly stand by, and no matter who you are, like even if you are coming under the spectrum or not, no matter who you are, where you're from, your skin color, gender identity, always speak yourself. Thank you.
Thank you,
Thank you,
Suzanne. That
Sujay.
was a final session, I'd say. Because in a limited time, you give us a lot of information, explained all the intricacies in the life led by LGBT community. I'm sure all of us now know better to be an all-encompassing community. Thank you so much. So now, if you have any doubts or queries or questions which you want to ask, you can ask her now. Hello, everyone. If you have any doubts or questions regarding the topic, you can either unmute your mic and ask her the question, or you can type the question in the chat box. Yes, sir.
Am I audible?
Yes, sir.
You're
Yes,
audible.
sir.
You're audible.
Yeah. See, I don't have any questions as such. I just wanted to make a couple of observations. Um, I am so happy that the Pete Educational Psychology Study Center has taken up a topic of such social relevance. And I remember when the brochure came out first a couple of weeks back, I got several messages from several friends, who stated that it's a very touchy area that we are treading on. And some of them said it was bold, some of them said it was courageous. But I could sense that the basic sentiment was one of curiosity and also probably a bit of caution. Um, it remains a fact that we still utter all these words in hushed tones, as Suzanne rightly said, and it would take years before we are able to view alternate sexualities, without a squint or probably a raised eyebrow. I feel so glad to see someone like Suzanne on a platform like this, talking to us on gender identities and issues, because I see you as a representative, of a younger generation that is so open to all sorts of possibilities. And what a beautiful presentation it has been, Suzanne. Facts and figures loaded with the right amount of empathy and emotions. Thank you so
Did you
much,
learn what
and
Peter
may
means?
your tribe increase. Thank you.
Thank you so much, sir. Thank you for your kind and
Hello.
encouraging words.
Hello. I am Professor Hemlata Talesra from Rajasthan.
Yes, ma'am. Yes, ma'am.
Congratulations, Suzanne, for delivered an excellent and very
Thank you so much.
knowledgeable descriptive lecture.
Thank you.
And your lecture will positively affect on the gender biased society and the education of girls. Thank you very much and
Thank,
congratulations.
thank you so much, ma'am.
Thank you so much, Hemlata ma'am, for being with us and encouraging
Thank
us so much.
you.
Thank you
Thank
so much.
you.
Does anyone have any questions so that I can answer from my limited knowledge?
Hi, Miss Susan.
Yes, ma'am.
I would like to ask something that is this knowledge of yours about LGBTQ, have you achieved it only through some while reading or some social media, or otherwise you have been studying it throughout your course or curriculum? Was that this type of topic in incorporated in your curriculum while you're studying?
Okay, the basic information about sexuality and gender orientation was incorporated into our psychiatry module that we had for the past 3 years, from our first year to third year. And from there, I've developed an interest. Basically, that is what the course did to me. I've developed an interest for the community and understanding that everything is not how you see in textbooks. Like, it's not just the textbook. uh, I have been very fortunate enough to be taught by one of my professors who is a gay man, and he opened us a window of information about how homosexual people are um, perceived in the society. And that was such a beautiful insight for me, because otherwise I myself would not have been uh, would not be knowing it as much like I did back then. And also the fact that a couple of my classmates, a couple of them were transgenders, and I've been very fortunate enough to work with them, and they are probably, like, when I interact with them, you know more about them, and it made it easier for me to understand life on how they see it and how hard it is for them to live in a judgmental society. So yes, that's my insight and inspiration behind the topic.
Thank you, Susan. Just I asked this just out of curiosity because we were much surprised when we had a training session when one of the clinical psychiatrists who came, who attended the session, and he was a resource person, and he was talking about sexuality. And we found it very
Mm-hmm.
offended when he was mocking or he was just insulting this type of community, and he was saying he attended a lot of them and he tried to. What I can say, he tried to convince them or he treated them. He is thinking it as a mental disease. And he
Mm-hmm.
also says that it is very good to have such people so that it earns him his bread and butter. And it was like some of us were discussing afterwards that, oh my God, it's very disgusting to see hear that. And I was surprised as a psychiatrist how he can tell like that, and he is not knowing that it is a biological thing and not a mental disease. That is why I asked it is if it is in your curriculum of psychiatry.
Yeah, I mean, it's completely normal. It's not even, this is not even supposed to be an issue in the first place, because being a homosexual is as normal as being a heterosexual. There is nothing wrong with it, because I feel like, can I ask the age, how old the doctor was? Maybe the generation can also affect, because a
Yeah,
lot
he
of the
was
times,
aged.
yeah, so it's hard for them to accept, first of all, that a community like that exists, and it's hard for them to believe that they exist and all those things. Like, it's genuinely unacceptable in their generation, and even this generation, it's still hard, but people are changing slowly, because from that's why as teachers, you guys can include them in the curriculum. If like there were rules from the Madras High Court and everything, that you can incorporate the LGBTQ topics in the school curriculum, so that it's easy for the next generation and the current generation to be very uh, to remain informed about the issue. So yeah.
Thank you, thank you.
Yes, Suzanne, madam. Very good afternoon.
Yes,
I'm Dr. Vaidya speaking
good afternoon.
from Mumbai.
Okay, hello ma'am. Hello
Actually,
ma'am.
I want to add something. Yeah,
Yeah.
hello. Actually, I want to add something in that what laws are there, particularly Indian laws are there regarding the rights of LGBT. That should also be covered somewhere, because from birth to death, all rights which are
Mhm.
available to the normal human beings, now they are also available to LGBTs. So
Yes,
this
yes.
aspect, I think, must be covered, so that they will also get right conscious, and everybody will come to know that even in the property they have equal rights. Even regarding the adoption, they have the right. So that kind of awareness, or some kind of addition in the presentation, if it is there, I think it will add to
Yes,
something.
ma'am. That's a great addition. I completely agree. The reason why I did not go to either the medical side or the legal side was because I wanted to focus the topic towards the LGBTQ students in schools, because we know that back in June 2018, the decriminalization of Section 377 happened. And even if that is so the case, it's still the cases that I have mentioned in the presentation are from post 2018. So no matter what the legal system has achieved, there is still prejudice, and there is still issues that students have to tackle in schools. And definitely obviously basic human rights are meant for LGBTQ community as well. I completely agree. Maybe
Yes,
another time.
yes,
Maybe
yes.
some other way.
Yeah, awareness along with rights, if both goes together,
Yes,
definitely there will be
yes.
social change, and social acceptability of these people will improve. Thank you for
Yeah.
best presentation.
Thank you so much.
Jibin.
Okay, so if there aren't any more questions, let's wind up the session. The feedback link is given on the chat box. That's it. So I request Rigma now to propose the vote of thanks.
No duty is more urgent than that of returning thanks. The ceremony here today stands incomplete without dedicating our deeply felt gratitude to the people without whom the occasion wouldn't be as meaningful as it is. First of all, I would like to extend my gratitude to Dr. Mariama Matthew, our principal, for continuously promoting this kind of interactive and informative programs for us. And also today is a special day for her, and we can feel how proud she is of her daughter. And congrats, ma'am, for that. Now, I would like to express my heartfelt thanks to our resource person, Ms. Suzanne George Kalapurackal. The topic of today's talk is pretty much need of the hour, and we owe a profound sense of gratitude to Ms. Suzanne Madam for giving such a detailed explanation about the LGBTQ community and their distress, all along with those case studies and statistics. We are looking forward to more such sessions from you, and we extend our love and care for you for being the part of Pete family. Now I express my deep gratitude to Dr. Ali Modi Varghese, Coordinator of PEPSC, and Dr. Velayathan Nayati, IQAC Convener, for coordinating and conducting the program and for coming up with such a relevant topic to be discussed. Next, I extend my gratitude to our Union Chairman, Mr. Arun Abi David, and all the members of Union Advaya 2K21 for your hard work in organizing new programs every now and then. I owe my deep sense of gratitude to all our teachers who were keenly involved throughout the program. There are delegates, students, teacher trainees from various parts of the country participating in the program through both Google Meet and YouTube live streaming. On behalf of our college IQAC, PEPSC, and College Union, I thank you all for your enthusiastic participation. Finally, I would like to thank all B.Ed and M.Ed students of our college whose cooperation is most inevitable for conducting this program. Once again, thank you all for making today's session wonderful.
Thank you, Rukma. Thank you once again, Suzanne. Thanks, everyone. We are winding up the session with the national anthem.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्छल जलधिधरंगा तव शुभ नामे जागे तव शुभ आशीष माहे गाहे तव जय गाथा जनगण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
Thank you, Suzanne, once again